We're here because we face a healthcare crisis of really historic magnitude, unprecedented, unparalleled in our history. In the midst of a pandemic, the President of the United States is nominating a justice who would decimate the major healthcare law in this country. Let me repeat. In the midst of a pandemic, the president is nominating a justice who would destroy the Affordable Care Act with protection for 130 million Americans who suffer from pre-existing conditions, as well as strike down reproductive freedoms guaranteed by Roe v. Wade. Now, I would vote against this nominee or any nominee proposed as part of this sham process barely a month before the election, with Americans already voting in 11 states. The American people deserve a voice in choosing the next justice, and it should be done by the next Senate and the next president. But this justice would do real harm to real people in real ways by depriving them of protection for pre-existing conditions that affect 1.5 million people in Connecticut alone, 130 million Americans. 52% of all people in Connecticut suffer from pre-existing conditions. 52% of our population would be deprived of health care coverage. That is horrifying. Beyond alarming, it is a horrific threat to real people in real ways that make a difference in their lives. How do we know that Judge Barrett would strike down the Affordable Care Act? Well, she has said so in her writings and opinions. She has said so when she criticized Chief Justice Roberts for upholding the Affordable Care Act because supposedly he pushed the law beyond its meaning, and I'm going to quote directly. According to Judge Barrett, the Chief Justice, quote, pushed the ACA beyond its plausible meaning to uphold the statute. She's also been vetted and screened by the Heritage Foundation and the Federalist Society, by all the groups that are determining Trump's choices of justices. She's been screened and vetted to pass 2 tests. The president's called them strong tests. Number 1, striking down the ACA. Number 2, overturning Roe v. Wade. So there is no doubt about where Justice Barrett is likely to go as a justice in depriving millions of people in Connecticut, hundreds of millions of people around the country of protection for pre-existing conditions. The effects would be catastrophic. The ramifications would be beyond comprehension for people who have come to rely on protection for pre-existing conditions, which now include COVID-19. Among all of the pre-existing conditions like cancer, heart disease, diabetes, asthma, now 7 million Americans have COVID-19 because they have survived it. They suffered through it. And they now have a pre-existing condition. The president is nominating a justice who would deprive those 7 million Americans who suffered from COVID-19 of health care coverage in the midst of a pandemic. What we should be doing is adopting another pandemic relief bill in the midst of this health care crisis. Instead, we're going to be preoccupied with this justice and the confirmation process. I'm getting the sign from Tony. Okay. So let me just conclude by saying there are threats to many essential rights and liberties, reproductive freedoms, gender equality, marriage equality, gun violence protection, non-discrimination. Essential rights and liberties are on the line in this nomination. But the effects on health care are potentially so catastrophic, it is reason alone to oppose this nomination. And I will be fighting for the people of Connecticut who will be deprived of health care access, as well as the people of our country in opposing this nomination during the hearings. Now, she will evade question, no question. She will duck the tough inquiries about what she would do. She will say that case is before the court, but the timing is really important here. 1 week after the election, on November 10th, this case will be argued. If Judge Barrett is confirmed, she will sit on the court for that argument. She will decide that case. Health care will be gone for millions of Americans within months, possibly by the end of the year. And so this crisis is real and immediate, and I think Americans should be aware of the consequences, and ultimately they are the ones who can make a difference. If they stand up and speak out, if we are successful in taking our case to the American people, if they convince their senators to oppose this nomination, we can win this fight. And that is what we hope to do. So let me introduce Senator Matt Lesser and Representative Sean Scanlon, who will come up together. Then Michael Taylor, who's the CEO of the Cornell Scott Hill Clinic, which we are fortunate to be visiting today. Claudia Gross of the State Medical Society. She's the immediate past president. Ted Doolittle, who is the healthcare advocate. Francis Badilla, president of the Universal Healthcare Foundation. Lisa Freeman, who is executive director of the Connecticut Center for Public Safety. Thank you all.
Good morning. I'm Senator Matt Lesser, and with my friend Sean Scanlon, I'm the co-chair of the Insurance and Real Estate Committee in the Connecticut State Senate. And I am here as a legislator, but also as a patient, because Judge Barrett, Mitch McConnell, Donald Trump, they may not care about the protections of the Affordable Care Act because they get health care from taxpayers. But as a cancer survivor, as a husband, as a soon-to-be father, I live with dread about the pre-existing conditions being brought back by an activist far right-wing court. The cruelty of this president seeking to take away health care from 20 million people in the middle of a pandemic is really hard to fathom. I just think he doesn't understand it. I was talking to a constituent last night, a resident of Connecticut, who is a diabetic, who is looking at the very real prospect of having to leave the country, having to leave the United States of America to get affordable insulin if this law gets struck down by an activist right-wing court hearing this case just 1 week after Election Day. It is outrageous, it is shameful, and I'm just very grateful for Senator Blumenthal's leadership on the national level, standing up for our health care in Connecticut. We're trying to move the ball forward. There are things we can do to make healthcare more affordable in this state, but we've got to build upon the Affordable Care Act, make it work better, not take us backwards, take us back over a decade to the point where people could be thrown off their insurance simply for having the flu, for being a woman, for being pregnant. That is outrageous. We should not accept it. It shouldn't be tolerated in this country, and I'm so glad we have a senator like Senator Blumenthal fighting for us.
Good morning, everybody. My name is Sean Scanlon. I'm the House Chair of the Insurance Committee, and I will echo what my co-chair, Senator Lesser, said. It's really great to have a senator like Senator Blumenthal, Senator Murphy fighting for us in Washington. You know, the people of Connecticut that I talk to, they don't care about Donald Trump's taxes. They don't care about what the latest poll or ad shows in this presidential race. They're sitting around their kitchen table worried about how they're going to afford their health care. They're worried about their child. They're worried about their spouse. They're worried about the fact that if their pre-existing conditions coverage goes away, their grandmother is no longer going to be insurable because she had cancer. They're worried about their 26-year-old child who's going to lose their insurance because they can no longer stay on mom or dad's plan. These people are really worried about this. And the last thing that we need in this country is 1 week after the voters say their piece and they declare their right and they say what they want to see in this country, that an unelected judge is going to determine the fate of their health care and the fate of millions and millions and millions of people's health care. So we're here today to stand with our U.S. Senator, who is doing an incredible job of fighting for us to make sure that this nomination is stopped, that the people of America have their voices heard when they say with loud and clear voices that they are not looking to lose their health care. They're not looking to lose their rights to marry who they want to marry. They're not looking to lose their rights for their own body and their own medical choices. These are things that are really at stake. Judge Amy Barrett Cohen is a clear and present danger to the way of life that we have become fortunate to have in this country through 50 years of jurisprudence. And we need to stop this nomination. And I know that Senator Blumenthal will do everything he can to do that. And I'm proud to stand with him and my co-chair, Senator Lesser, as he does that. Thank you.
Great. Thank you.
Good morning, everyone. I'm going to remove my mask first. Welcome to the Cornell Scott Hill Health Center. I am Michael Taylor, the CEO of this wonderful organization. I first want to welcome you all here today. And I also want to thank Senator Blumenthal for his leadership and always being a pioneer for those who really need assistance. And thanks as well to our state legislators and to the other luminaries who have joined us today. I must tell you, I am absolutely anxious beyond belief at the prospect of going back to before ACA. When I think about the implementation of ACA, the Affordable Care Act 10 years ago, I remember very vividly sitting down with patients who we were assisting in enrolling for coverage and watching the tears roll from their face. One woman, because she could finally get the operation that she knew she needed, but she was gaining coverage because of ACA. The prospect of that being rolled back is horrifying to me. I also remember the public discourse and debate and review and implications of the very intricacies of the Affordable Care Act. So when someone talks now about overturning it and introducing a phantom plan that nobody knows anything about because no details have been forthcoming, I am very fearful of what happens and reliving history and going back to a time where people had no coverage. I'm concerned about that, not only for the welfare and health of our patients, now 50,000, in excess of 50,000 New Haven County residents a year, but I am also concerned as the CEO of this organization about how we care for all of those people when they don't have insurance coverage. And we go back to the days of having to pinch pennies to figure out how we care for all of these uninsured people. This is wrong. It is wrong. So I thank you, Senator Blumenthal, for leading the charge on this. Will be devastating to people in our own community. Thank you.
Thank you, and thanks for having us. We're now going to hear from Dr. Claudia Gross, and then Ted Doolittle, Francis Badilla, and Lisa Freeman. And thank you so much for giving us this opportunity.
Thank you, Senator Blumenthal, for hosting this event. We all think it's very important. I'm Dr. Claudia Gross, and I'm the immediate past president of the Connecticut State Medical Society, but also, and representing the society, but also more importantly, I'm a gastroenterologist, and I'm also a patient, as everyone here is at one time or another. The Connecticut State Medical Society's priority is to ensure that millions of Americans who have gained health care insurance because of the Affordable Care Act maintain access to affordable, quality medical care. In validating a law that has expanded access to health insurance would have a devastating impact on doctors, patients, who even in normal times and especially during this time of the pandemic need this coverage. If the Affordable Care Act is invalidated, number one, patients will no longer have guaranteed coverage for pre-existing conditions, as other people have said, including the chronic effects, the chronic after effects of COVID-19. Young adults would no longer have coverage under their parents' health insurance plan until age 26. 100% coverage for certain preventive services would cease. Medicaid eligibility expansion will end, as would federal funding for Medicaid expansion. Annual and lifetime caps on medical coverage could be reinstated. Individual marketplace and premium subsidies based on income would be eliminated. To strike down the Affordable Care Act at a time when our healthcare system is struggling to respond to a worldwide pandemic could leave millions of Americans without access to treatment and further increase the economic impact of this pandemic. We do have to take this in consideration, and we certainly appreciate what Senator Blumenthal is doing on the national level, and our legislators are doing at the state level to keep coverage for everyone in Connecticut and in the nation. Thank you.
Thank you, Josh. Thank you so much.
Thanks, Senator Blumenthal. My name is Ted Doolittle. I'm the state healthcare advocate, and I lead a team of attorneys, paralegals, nurses, and others who every day represent folks in Connecticut who are struggling with their health insurance, whether they've had a claim denied or something of that nature. We can represent them for free at the Office of the Healthcare Advocate. I also am an attorney, and I have a deep appellate experience, especially in the federal courts. I have argued over 15 cases. I've argued 15 cases in the courts of appeals around the country. I've filed many filings in courts of appeals as well as the U.S. Supreme Court. And obviously, as a healthcare advocate, my outlook on this Supreme Court nomination, any Supreme Court nomination, is always looking out for the about 1,000 Connecticut citizens who call my office for assistance every year that have Affordable Care Act plans. And that is in danger. Senator Blumenthal earlier referenced a 2017 Minnesota constitutional commentary article by Judge Barrett in which she very clearly states that she, if she had the opportunity, would overturn the Affordable Care Act. That to me is not an issue of constitutional law. It's really an issue of healthcare law. It's not that complicated, and Judge Barrett is making it more complicated than it needs to be. There's two main parts to the Affordable Care Act, and one is the expansion of Medicaid. Is there anybody here in this country who thinks that Medicaid is unconstitutional or illegal? Well, no. So the expansion of it should not be as well. The other main part of the Affordable Care Act is the assistance given to people who are of limited income to buy health insurance. Is that a departure from what we've had in our country for decades? No, it's not. There's a part of Medicare, it's called the Medicare Savings Program, where as soon as you hit 65 and you go into Medicare, you have to pay for Medicare. Many people don't know that. If you are under a certain income, you get assistance from the government. Those are the two parts of the Affordable Care Act: an expansion of Medicaid and something that copies something that already is existing in Medicare savings program. This is not a complicated constitutional law question. It's a question of healthcare law. Judge Barrett, for all her scholarly achievements, has clearly stated that she doesn't have the sophistication needed in the healthcare arena, let alone the constitutional law arena. And that is why I'm very disturbed by any nominee from any party that believes that the ACA decision was not rightly decided. The ACA decision was flawed in many ways. However, underlying it is the fact that it's very simple. The U.S. government has the authority to provide for the common welfare. part of that in modern society is health insurance. And that is why I strongly support Senator Blumenthal and Senator Murphy in their efforts on Capitol Hill. And thank you all for the chance to comment today.
Thank you, Senator Blumenthal. I very much appreciate your leadership. Senator Blumenthal was instrumental in the formation of the Universal Healthcare Foundation of Connecticut 20 years ago, and continues to be a health justice warrior for us here in Connecticut and the country. And even in 2017, you also, in the face of repeal efforts against the ACA, led the way to protect the ACA. Thank you very much. My name is Frances Badilla. I'm president of the Universal Healthcare Foundation, and I'm here to say that it is not less healthcare that we need, it is more healthcare. And the thought of losing the ACA after 10 years, the ACA has been a work in progress for certain, but it has made a major difference for 20 million Americans and for millions of people in our state. The hallmark of the ACA is, in fact, the inability to exclude anyone on the basis of pre-existing conditions. That means not charging more for health premiums. That means not denying people. My husband was denied health care coverage right before I went to work at the Universal Healthcare Foundation on the basis of his high blood pressure and his weight. He was denied coverage. That's what we would go back to. I have family members with pre-existing conditions who would suffer. Connecticut residents would suffer if we lose this important protection, and not just the protection, but the entire act. The incidence of breast cancer, for example, breast cancer survivors who were in remission before the Affordable Care Act could be precluded from getting health insurance for 5 years. Now, how many of us have loved ones who have survived breast cancer? The leading causes of death in Greater New Haven alone, which is my community where I live, are cancer, heart disease, asthma, diabetes, and hypertension. These are all pre-existing conditions. COVID has made this situation even more significant, and particularly affecting Black and brown people in our communities all over the state and all over the country more significantly. These particular leading causes of death also happen to be overly represented among Black and brown people. So this is really a matter of life and death. The decision by a Supreme Court to take away the health care of people seems inhumane. That's all there is to it. It seems inhumane. There is no country in the world that would consider such a thing. Only here, the United States. On an economic front, how many people have lost their jobs because of COVID? How many more people are uninsured because they've lost their jobs? We have some of the highest healthcare costs in Connecticut are here in the country, are here in Connecticut. It costs more to get family coverage in Connecticut than it does to buy a Ford Focus. Just think about that. And so this situation that we are in right now, we must all raise our voices and we must protest loudly of these movements to eradicate healthcare at a moment when people are suffering during a pandemic, when even beyond the pandemic, we will have lasting impacts of the COVID-19 virus, and we need more healthcare, not less. Thank you very much for inviting me today.
Thank you, Senator Blumenthal. I want to thank the senator for inviting us and my organization, the Connecticut Center for Patient Safety, and for convening this press conference today to talk about the Affordable Care Act and events around replacing the late Justice Ginsburg on the Supreme Court, the consequences to healthcare coverage for many Connecticut residents and Americans that this all might bring about. I also want to thank our first responders and frontline workers who have saved the lives of so many and put their health on the line for all of us.
The Connecticut Center for Patient Safety works within our communities and the state of Connecticut to bring about safer, high-quality health care to all of our residents and to protect the rights of patients. With the nomination of Judge Barrett to the Supreme Court and the potential for the Supreme Court to become a very conservative court, we are concerned about the future rights of patients everywhere to be able to continue to have high-quality health care. It has been widely reported in the news that should Ms. Barrett be seated on the Supreme Court, there is a great likelihood that the Affordable Care Act, which we have seen bring medical coverage to many previously uninsured Americans, will be struck down. The courts, including the Supreme Court, have already eroded parts of the Affordable Care Act, and we cannot afford to lose any other components of it. While the act itself may not be perfect, it can still be improved, and it will be a terrible loss to the people of the state of Connecticut and our country should they not have coverage that has been afforded to them and assured to them through the Affordable Care Act. Over 30 million Americans gained health insurance when they were previously uninsured. Medicaid was expanded in 37 states, bringing insurance to people who previously could not afford it. Young adult children were now covered under their parents' policies. Under the ACA, Medicare stopped reimbursing hospitals for the treatment of hospital-acquired infections, and the rates of infections and deaths due to infections dropped significantly. Preventative testing and screenings, which picked up many conditions such as cancers at a very early stage, were covered 100% through the Affordable Care Act, this reducing the cost of long-term treatment for advanced chronic and serious illness. Lifetime caps on insurance coverage also were removed, so people facing catastrophic illnesses or serious chronic conditions no longer had to worry that the day would come where they could no longer afford their health care. I don't think there is anyone out there who is saying that the Affordable Care Act is perfect in its current form, nor that improvements can't and shouldn't be made. But the ACA brought access to health care to many. It is saving lives because of that. And we would continue to give people who would otherwise be uninsured access to and guarantee that they can have health insurance. The sum total of everything that the Affordable Care Act brought to Connecticut residents and Americans is that lives are being saved and money is being saved. Let's not get rid of something that, while imperfect, is improving the situation for many residents. Let's make it better, and let's move forward, improving health care all around. What happens at the Supreme Court will impact the quality of health care for at least a generation. Please think about this, and please make sure to get out and vote. Thank you so much, Senator.
What is your name, ma'am? I'm sorry.
Lisa Freeman.
Thank you, Lisa.
You're welcome. Thank you.
I want to, again, thank Michael Taylor and the Cornell Scott Hill Center for having us, and just to echo what one of our speakers said, we owe so much to the frontline workers who themselves, many of them, now suffer from pre-existing conditions, and they would be deprived of coverage as well. The people who are harmed in real ways in their lives are your friends and neighbors, your loved ones, yourself, anybody who has diabetes or asthma or high blood pressure or cancer. Go down the list. Now it's COVID-19. Losing health care for those people is beyond cruel. It is also economically costly. It will cost us lives, it will cost us dollars and cents, because in the long run we'll pay more at some point, pay now or pay later. I'm happy to take some questions in the time that we have.
Senator, can you talk about, just bring us up to speed on this measure the President introduced last week, where he says those with pre-existing conditions would be protected moving forward?
The President issued a totally meaningless executive order. He can't cover people with pre-existing conditions. Only the law can. he's in favor of striking down the law, his executive order would be meaningless. He has no authority to do what the law can do if that law is struck down. So this sham and fraud of saying, oh, well, we're covering pre-existing conditions by executive order, he has no authority to do it.
Sir, can I also ask you, with regard to under the umbrella of if the shoe were on the other foot, if there was a Democratic president and a democratically controlled Senate, would the Democrats not do the same thing that the Republicans are doing now? What do you believe?
What the Republicans are doing right now is not normal. What the Republicans are doing now, barely a month before the election, is very different from what President Obama sought to do in nominating Merrick Garland 9 months before the election. This rush to approve a justice that would strike down protection for people with pre-existing conditions, who would eliminate reproductive freedoms, who would endanger marriage equality, gun violence protection, contrary to the will of the people, is not normal. The American people should have a voice. They should have a say in this election. They are now going to the ballot box, in essence, in 11 states. The election is underway. A Democratic president and a Democratic Congress would never do such a thing. In fact, it has never been done before. President Lincoln postponed his nomination under similar circumstances because he thought that the new president and the new Congress should decide. That's what President Trump should do.
Can you just give us your thoughts and expectations on tonight's debate?
I think tonight's debate is going to be about people with pre-existing conditions. I think that's what's going to move people. As Representative Scanlon said, you know, I go around Connecticut. I listen. I hear people. There's such hardship and heartbreak because of the worry, in fact, the anxiety and the anger about this pandemic. I think COVID-19 is going to be front and center. The 206,000 Americans who've needlessly lost their lives, the 7 million who have suffered from this pandemic, the millions who are unemployed, their voices are going to be in this debate tonight, and they should be. But in the meantime, we need to continue this fight, because what you've heard here, and I really can't say enough how grateful I am to the folks who are on the front line, and they're represented here, and they see and hear these stories firsthand. What they have told is, in some ways, as valuable as the debate, because they reflect for you the real story about what's happening to America, and even worse, what would happen if people with pre-existing conditions lose their coverage. It would be catastrophic in a humanitarian crisis. And we are potentially on the cusp of a humanitarian crisis. November 10th is the argument. Judge Barrett, if she's confirmed, will sit on it. Within days or months, there will be a decision with a 6-3 majority, potentially striking down the Affordable Care Act.
Senator, would you be in favor of, if Joe Biden wins the White House and the Senate becomes democratically controlled again, would you be in favor of packing the court? There's been talk about this.
My focus is on these next days and weeks in taking our case to the American people, even before the election, in the hope that they will stand up and speak out so their senators will vote against this nomination. I want to hold these senators accountable and make them feel accountable in this upcoming election. That's my focus. For any of the potential remedies to be pursued after the election, Democrats have to win the presidency and they have to take back the Senate. And that ought to be the focus, namely the election. Can we just finish here? Thank you.
Just another question about meeting with Judge Barrett. You're on the Judiciary Committee, of course.
Yeah.
Why have you chosen not to meet with her?
Well,
She's in Washington today.
You know, let me say first, I've been through these meetings, and my feeling is the American people should hear from Judge Barrett whatever she has to say to me behind closed doors. I want her to tell me the answers to my questions in public, in the open, under oath, and I would refuse to meet with any nominee as part of a sham process barely a month before the election. It isn't about the nominee, it's about the nomination process that I consider so flawed.
I understand they weren't in election years, but 4 times since 1975, there have been judges that have been nominated and confirmed in less than 43 days. Again, it wasn't in an election year, but it's been done before.
You mean nominations?
Nominations and confirmations, including Justice Ginsburg, within fewer than 43 days. So, in other words, this whole process started at around 45
No
days ago.
judge has been confirmed after July in an election year.
I didn't mean in an election year, but I just mean from start to finish.
The average
the
is
process.
71 days.
Right.
And this process is going to be less than 71 days and less than many other justices. But we should be given the time necessary. Most important, the American people deserve a voice. My complaint is not only about the short length of time, it is about when the vote will occur. On the present timetable, this vote on Judge Barrett will occur literally at the end of October, days before the election, when the American people should have a voice.
And you know what the Republicans say to you, elections have consequences. That's what they have been saying.
And they should have consequences. The American people should have a voice. They should have a say. This choice should be by the American people in this election, electing a new Senate and a new president who should be the ones to decide. This is not normal. No confirmation has taken place after July of an election year, ever. And presidents like Abraham Lincoln have decided to postpone it when a similar choice was given to them.
It's been like 1940 was the last time a justice was confirmed in an election year
Right.
or something. Thank you, Senator.
Thank you, everyone.
Thanks for your time.
Take care. Thank you.